Hello everybody. We're going to pick up back in your lab handout to do the knee joint stretching, manual hold relax, and your agonist contract stretches. So we're starting here with Brianna, using her lower extremity to show you both hamstring and quad stretching. So the first stretch that I would like to do is to increase knee flexion. So knee flexion, stretching the quadricep muscles. Okay. So as usual for our manual static stretch, I'm going to the point of tightness. Do you feel tight there, Bri?
Yes.
Yes, we're going a little bit further and we're going to hold it for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. We're doing that 3 times, adjusting, of course, the second holds as needed for your patient. As you can see here, I have a towel roll so that we can clear the patellar joint. Okay, so you don't want any compression of the patellofemoral joint into the plinth. Okay, so make sure you put your towel roll. All right, so now let's do the hold relax technique, for the quadriceps. So we're gonna make that quadriceps muscle contract isometrically for 10 seconds before we stretch. So again, we're going to the point of tightness. Do you feel tight there, Bri?
Yes.
We're gonna back off 5 to 10 degrees, and now she's gonna kick into extension. So kick into my hand down. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and we're going to relax and bring that to a stretch. You feel stretched, Bri?
Yes.
1, 2, 3, 4, 5, 6, 7. You can count with me. 8, 9, 10, 30. All right, good. And so let's say we did that 2 more times. Okay. So now, and really make sure that they're not rotating or they're not abducting. So make sure when you're doing your stretch, you're not pulling towards you. Okay, so keep them nice and neutral. All right, so the next stretch we're going to do is the agonist contract for the quadricep group again to increase knee flexion. So again, we go to the point of tightness. Ask my patient, do they feel tight there?
Yes.
She says yes, perfect. So we back up 20 to 30 degrees. Now we're creating a contraction for the hamstrings. So you can either use this hand to create it or flip your hand here, because you eventually have to get that stabilization happening. So I just flip my hand. I'm going to say, okay, kick back towards my hand, towards your buttocks with your heel. Kick back, come on. Keep going, push. I'm going to allow you to move. Push, keep going, push, and relax, Bri. And do you feel a stretch here?
Yes.
In the front of your leg. Good. And we're going to count to 30 again. 1, 2, 3, 4, 5, 30. I'm shortening it more and more. Okay, so you've got your agonist contract, your hold relax, your manual static techniques for your quadricep group. Now, to increase knee extension, obviously, Brianna here, she has a Jenny Recurvitum knee, so it's not that she needs it, but if we were to create the contracture, it would look something like this. So can you hold your leg just like so? Okay? So I don't know if you need G to come over and take this angle. So let's say her flexion contracture was somewhere around negative 20 degrees of extension. Obviously, it's an indication to stretch hamstrings. Okay? So I would be pushing down this way for her stretch into extension. Still stabilizing at the PSIS, they still have the towel to clear the patella. So if my patient had that contracture, I'm going from here into extension. I'm going to feel resistance at end range, and I'm going to say, do you feel tight there? And we're mocking it, so just say yes. And then we're going to go a little bit further into the stretch, and I'm going to ask her, do you feel a stretch? And she's going to say, yes, I feel a stretch. All right, we're holding for 30 seconds. 1, 2, 3, 4, 5, 6, 30. Okay? So just mocking a contracture there. All right, the next one we're going to do for the hamstrings is your manual technique, hold relax. Okay? So obviously we're doing an isometric contraction to the hamstrings now. So we're going to the point of tightness. I'm going to fake that contracture, about negative 20 degrees. You feel tight there?
Yes.
Breathe, yes. I'm going to bring her back 5 to 10 degrees. I went too far. Sorry. 5 to 10 degrees. And I'm going to ask her now to kick up into flexion at the knee. So bring her heel towards her buttocks. So come on up and push against my hand. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax, Bri. And we're going down for the stretch. You feel the stretch?
Yes.
Yes, and we're going to 30. 1, 2, 3, 4, 5, 6, 30. Thank you for counting with me. All right. So that was your hold, relax. Now we're going to do the agonist contract stretch for the hamstrings. So we're going to the point of tightness. Okay, she feels tight there, right, Brie?
Yes.
And we're backing off 20 to 30 degrees. Now we're causing the isotonic contraction to the quadricep group. So now I'm going to ask her to kick down towards the plinth. Kick, 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 kick. I'm going to allow her to move. It's an isotonic. Then I'm going to tell her to relax. And then I'm going to switch my hand, and now I'm going to give her the stretch. Do you feel stretch?
Yes.
Okay, and I'm still stabilizing. So now we're counting to 30. So make sure you do, as you say, stop to your patient, relax. You have to make sure you have the patient where you need to be. You're supporting, but yet a firm grip for pressing into extension and feeling that stretch. All right, and that is knee joint stretching.